Welcome everybody to the first session in our health equity webinar series. For those of you who do not know me, my name is Lydia Isaac. I am the Vice President for Health Equity and Policy here at the National Urban League. I do want to do a quick introduction of Ali Hoban, who is our Director of Health Equity and Policy here at the National Urban League, and Lillian Mehan, who is our Scholar in Residence. We have a Scholar in Residence who's helping us with this webinar series. She's our webinar series gurus, I want to say, our guru, who is really, so you'll be hearing a lot more from Lillian as this series goes on, but I wanted to start and do the first one. So this is the first one, and we're really excited about it. And we plan to have one of these monthly. You'll be getting some information about the February one probably within the next week or so. And it really is just an opportunity for us to bring information to the movement, have good conversations about what is happening, in the world of health equity and healthcare, and just to have conversations to help us to think through how we help people live the best life possible and the healthiest life possible and advancing health equity. So one of the ways we decided to start this webinar was with me. Doing just really a foundational kind of basic, I won't call it basic not the right word, but a foundational session on health equity, the social determinants of health, and what does it mean for the movement. And so this is going to be, for some folks who have come to Whitney M. Young, a little bit repetitive, not totally repetitive. It really is about getting us all on the same basis and allowing space for us to have conversations about what this means, how do I implement this in the movement, what are the issues that are coming up for you that you're seeing, and really us having dialogue and thinking through what I hope to come out of these webinars is that this gives you some baseline knowledge, and then we might maybe have professional development activities or have another webinar that dives deeper into some of these topics, because of course, in the course of less than an hour, there's also much you can do. And so I'm hoping this will spark people's interest to want to do more or think more about some of these issues. So just for some small housekeeping things, everybody stay on mute, of course, because we know we're recording this. So this will hopefully end up being somewhere on our YouTube page. We're recording this for prosperity, so we want to make sure the sound is the best. We have the chat function and the Q&A sessions function. Both Lillian and Ali are going to be looking at both of them, so please use them. There's going to be a portion a little later on in this session where I'm going to ask folks to chat things in. We're going to try to use the chat just because there's so many people and it just gets really noisy, and sometimes we can't see everybody when you have this many people. Also, today we're doing the meeting function. We're also going to move to using Zoom webinar, which also makes it a little easier to do some of these things starting next month. But this is our first one. It's a little bit of our trial run, and we're excited about it. And we're excited to have all of you here. I'm so excited about all the folks who decided to join us. So that's just the small housekeeping. But also the other thing, for me personally, and I think each session will just let the speakers decide, if you have a question while I'm speaking, please put it in the chat, and and somebody will alert me. I'm actually usually always looking at the chat also, and I'll answer it in real time. You don't have to save it till the end, but we also will have some time at the end for questions. So don't feel shy or feel like you can't ask questions during what we're talking about. And I'm also trying to make this as interactive as possible. We'll see how it goes. But the first few slides are definitely just going to be me talking, and then we're going to get into some more interactive actions. So let's see if I can actually move the slide. Here we go. Okay, so the first session, January 2023, is health equity and the social determinants of health. And y'all know me, most of you know me, but this is my bio, and it's there for prosperity for you all to read when you want to read, and you can ask me any questions about anything in my journey at some other point. And I wanted to start, which is a little bit of a controversial, maybe not a controversial in this room, slide with this statement that health is not health care. A lot of times, as I have been talking with people in the movement, or even people outside of the movement, people have a tendency to conflate this issue of health and healthcare. And I think it's really important for the work that you all do for us not to think of health as just healthcare, and for us to really think through that health is so much larger than healthcare. And I really like this definition from the World Health Organization, which says that health is a state of complete physical, mental, and social well-being, and is not merely the absence of disease or infirmity. And what the World Health Organization is saying here is that to be healthy is not just not to have disease. To be healthy is to be secure in your life, to be happy, whatever your definition of happy is, to have mental and physical wellness, to have social well-being, being able to live in a neighborhood that you feel safe in, that you can have good housing in, where you can have access to resources. And so using this definition, I want it to really be our basis of we're trying to, I know all of you are trying to make sure that your communities are as healthy as possible. And so how do we get folks to this state, right, of not just absence of disease, but actual complete physical, mental, and social well-being? And so, but the other thing I want to say, because I know there's probably some physicians or clinical professionals on this call, I am not by any means kind of reducing the importance of medical care. Medical care is an essential component of health. It was designed, right, to address disease by diagnosing and treating, right? And I think that's really important, that sometimes we ask or we want our healthcare system to do more than it was designed or it's able to do. Doesn't mean it shouldn't take into consideration these other factors. That's not what I'm saying. What I'm saying is that we also have to remember what healthcare is meant to do. Our healthcare clinical professionals are meant to say, identify a problem and help you be able to manage and or cure or treat the problem. And so that's why you cannot have health without having healthcare. So I don't want us to minimize the importance of healthcare, but I just want to make sure that we don't conflate that healthcare is just health, because health is so much larger than healthcare. That being said, I like this figure a lot. I use it, folks have already seen it, because it's important for us to know what are the factors that influence health, right? And as you can see, this shocks a lot of people a lot of time when you see this figure, because most people think, as long as I can get access to a doctor, as long as I can have, mental health care, as long as I can have what we call clinical care, I will be okay. But if you look at it, only 20% of factors that influence health are attributed to clinical care, which is healthcare quality and access, right? 30% is health behaviors, what we do every day. If you're somebody who likes to jump out of planes, let's hope that, that parachute works, but there's the opportunity that the parachute may not work, right? That's a health behavior. And most of the time the parachute works, so we're okay. But I wanted to use something that was kind of innocuous, because I also don't want us to victim blame people. And so jumping out of a plane is fairly innocuous. And then the other 50% is social, economic, and physical environment factors. So community conditions, where you live, how you get to work, where you go to school, where you work, how much money you have, the air quality, what do you have access to, safety, all of those things. So when you add health behaviors and social and economic and physical environment together, 80% of your health is influenced by something that is non-medical. And I think that's really important for people to understand, because therefore we then cannot say that the healthcare system is the solution to all problems. It's an important aspect of the problem, meaning that when we have health issues, we need to have a functioning, quality healthcare system, but it cannot solve the problems that we're having health-wise in our country if we don't look at these other factors. And we also know, everybody on this call knows, that things like poverty, racism, discrimination, trauma, violence, and toxic stress influence all of these factors and are evident and part of all of these systems and all of these institutions. And that's important for us to know too, and how we impact our health. So I see there's a question in chat maybe, or maybe not. Sorry, my chat function also. Oh, everybody's just saying hi. No problem. Great. All right. So did I go too far? Let me just make sure I didn't go too far. Nope, I'm going the other way. Sorry about that. So it's important for us to talk about then this thing that has been basically part of my career, my whole career, and thinking about health and how do we keep communities, and particularly Black communities, vulnerable communities, communities that have been marginalized as healthy as can be. And what has come up in the field, which I think a lot of people have started hearing a lot about in the COVID epidemic, has really kind of enlightened this for people, is this idea of the social determinants of health, right? And those are all the non-medical factors, all the things that I just talked about that influence your health. And, you know, I'm using a lot of definitions from the World Health Organization because they spent a lot of time studying and really thinking about some of the best definitions for this. And it's just simply the conditions in which people are born, grow, live, work, and age. Some people like to put love, some people like to put other aspects, but it's essentially what I like about the World Health Organization definition is they're very conscious of saying that these circumstances are shaped by this distribution of money, power, and resources at a global, national, and local level. And what that does by adding that to the definition takes it away, or I won't say takes it away, but doesn't put the onus of being healthy on the individual. It puts the onus of being healthy on all of us. Your community, your local government, your national government, the world decides how healthy we are based on what we're doing in the world. And that's why I know some people are like, well, I don't care what's happening, you know, across the country, or I don't care what's happening in another country, but it actually matters because what's happening in those countries impact you and impact your health, right? So it's important for us to understand and be a global community because a global community has social determinants, and those social determinants impact all of our health. So here is just a really nice graphic. I like to use this graphic because a lot of time people ask me, well, Lydia, okay, you talk about these social determinants. I don't know what that is, what they are, right? And these are just all of the things. There's different examples here. Employment. I like to use employment a lot, and housing, because a lot of the movement does a lot of really great employment work and housing assistant work and education work. Access to health services, there goes back to what I was talking about, medical care. One of the fundamental things we can do for people is that when they get sick, let them have the ability to get the care they need. That's an important determinant of health, right? If you do not have access, you cannot get the help you need to solve whatever problem you're having. So that's important. Family income. We know that usually most people stay in the same income bracket that they were born in. We don't have as much social, as much as we want to try to act like, you know, by your bootstraps. That's an American thing, you know, I'm gonna, succeed by, whatever, the saying I'm trying to say, by your bootstraps. Most people stay in the family strata that they were born into, right? And so then that's an important thing to know. We don't have as much social mobility in the US as we think we do. I know a lot of people think they do because you'll see somebody on television and they're like, I grew up poor and now I'm this. That's actually the anomaly. That's not the norm. Right? Most people stay in where in what strata they were born in. That being said, that means why we have to make sure that whatever somebody's family income is, that they have the supports and the resources they need to live a healthy life. Your income should not determine your health, but it actually does in this country. And that's something that we have to really work on. All right. So you're going to hear this word a lot. I'm trying to also define terms for folks. And there's this, in the US in particular, we like to use the term health disparity when we want to describe the differences happening in our country between different groups. We say a health disparity. And then there's some other countries and some other places that want to use health inequity. And so what's the difference? A disparity is just a difference in health status between people, right? And it could be related to social economic factors, to demographics, to race, to gender. A disparity, which is actually maybe not a bad thing, is that there's a tendency for people who were born male to be taller than people who were born female. That's technically a disparity. Is there something wrong with that disparity? No, that's just how, the genetics have laid it out this way, that for some reason, folks with a Y chromosome have a tendency to, Y chromosome, I'm right, have a tendency to be taller. And that's not everybody, that's in general. But if you do a general look at heights, people with a Y chromosome are taller than people with two X's, right? Now, some people would say that's a difference, and that could be a disparity. It's not really a disparity. because a disparity, in the way the US defines disparity, it is a disparity. But what we really are talking about is inequities, things that are unfair and avoidable. Height differences, unless it's due to developmental differences, not getting a kid the food they need to grow, is not a disparity that's unavoidable. It's just something that's happened in our genetics, right? Some people have brown hair, some people have blonde hair. That's a difference. There's nothing wrong with that difference. It's not unfair and it's not avoidable. But a health inequity, right? If you want to use that term, which is actually used in other countries, they use health inequality is what most countries use. We're the only one that use disparity. And I will say, for people who haven't heard me say this, our government chose to use disparity and actually strike out inequality for a reason, because they did not want this whole unfair and unavoidable differences to be something that gets talked about, right? And we actually are seeing, it's interesting because the disparity language came out probably 20, 30 years ago, but we're seeing this right now in our country with not wanting to teach in Florida AP African-American history, or for not having certain books about the Holocaust be present in a library. It's this kind of masking of that there's unfair practices in this country that cause issues, right? And so though Europe and most of the rest of the world have used something like unequal, which then also implies some unfairness, we have chosen a very innocuous word called disparities. So you will hear me say, I will say this, you will hear me use the word disparities because that's how I was trained, right? I grew up, I was trained in the disparities language. I am trying my best to move to inequities language, but sometimes the word disparity slips out. For me, I use them interchangeably, but I think it's important for us to understand language and that our government intentionally chose for our kind of field in the US to use the word disparities and not inequities or inequalities. And that's important. And like I said, we're seeing it now with what's happening across the country around critical race theory, around, these different teaching African-American history, teaching things that, quote unquote, going to make people feel guilty. So health inequities on the other side are really talking about something that's unfair and avoidable differences in health status seen between countries, within populations. There is I'll show you a number later on. African Americans, for example, live almost 10 years on average. This is not every person, because we all know somebody who, everybody has a grandmother who lived to 98. My grandfather lived to 98, right? But we're talking about on average, African American men in particular live 10 years younger than the group that has the highest average age of living, right? And so that's an inequity. There's a reason, there's something that's happening there that's causing that difference, right? And that difference is not benign. That difference is not just, it fell by chance that way. Something is causing Black people in particular to die earlier than they should. And it's something that we need to address. And that's what inequities are. All right, any questions? And actually, this is the next slide. So any questions or thoughts before I move on? So, it's interesting. I want to talk about how do social determinants of health factors influence health outcomes. We're actually going to get to that in a little bit after I talk about health equity. But I did want to show that health disparities, and see, I'm using the word because, in the US, but health inequities are the pathway by which inequities manifest. So disparities are the pathway by which inequities manifest. So here's the example I was giving. So Black Americans have a life expectancy at birth, and that's how we do life expectancy at birth. That's of 74.8 years, which is over 10 years less than the group with the highest life expectancy. Actually, the group with the highest life expectancy in the US is actually Asian Americans, and their life expectancy, I believe, is 85.2. So we are at 74.8. African Americans are at 74.8. The infant mortality rate for Black mothers is 10.38 deaths per 1,000 live births, which is the highest rate among all mothers in the United States. And what's really important about, and we're going to talk about this later on, I'm going to use these examples further on to talk about the pathways for inequities, is that regardless of a woman's educational and or economic status, the infant mortality rate for Black mothers is still so much higher than any other group. And then for the latest numbers I could get, from 2015 to 2018, almost a quarter of Black Americans who were diagnosed with diabetes did not have their A1C under control. And this is their sugar under control, as some people call it. Why is that important? That's an access to care issue, right? So this goes back to what I was saying about, even though medical care is not the only factor, it's an important factor, because we know that folks who have diabetes and who have diabetes complications, they can lose their limbs, they can go blind, they can have heart attacks. Those are consequences of diabetes. And it's really important to have diabetes managed for those reasons so that somebody can live the healthiest life possible. Okay, so this title of this session is Health Equity and Social Determinants of Health. I wanted to talk to you about the social determinants, the things that lead to inequities. But what do we want to achieve? What we want to achieve is to get everybody to advance health equity for our communities. And so I like this Robert Wood Johnson Foundation definition of health equity, which is that health equity means that everyone has a fair and a just, that's an important part, a just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education, housing, safe environments, and health care. So encompassed in this definition is all the social determinants I was talking about. In order for us to get to health equity, in order for us to have an equitable society, in order for us to have people who are as healthy as possible as they can possibly be. And here's the thing, health, the definition of healthy as possibly be is different for everybody. If I am a 3-time cancer survivor, my definition of health is very different from a 25-year-old who has never had any kind of issues definition of health. So we have to also know that a person can determine what health means to them. If I'm a diabetic who happens to be suffering from possibly the chance of my legs getting amputated, for me, health is not getting my legs amputated. Right? That is right. That's what they're thinking about, because that is their most immediate health need. And so as healthy as you can possibly be, right? And so it's really important for us to think about that. This is what we're trying to get people to. We're trying to advance health equity to get people to have a fair and just opportunity to be as healthy as possible. So, sorry. This thing is covering my slide, but that's okay. So here's another, sorry, it didn't move. That's what I was trying to say. So what does that mean? That means that we have to improve the health of social groups who have historically been marginalized, excluded, or otherwise placed at a social disadvantage. And we can only do this, right? Not by healthcare, but, and not that we shouldn't improve healthcare. So let me just step back. We have to do this by not only improving healthcare, but also the social determinants of health that affects these groups. And I think this is an important message for the people on this call, because the work that the National Urban League, that the Urban League movement does, is social determinants of health work, right? I don't want anybody to leave this call thinking, oh my goodness, I need to figure out a health program. You all are already doing health programs. The work that you do every day in helping people in your community get access to resources, figure out how to make things better for them, is social determinants of health work, is health equity work, is getting people access to the resources that they need to live the healthiest life possible. I'm gonna take a second because I think there is a comment. So John is saying that the Urban League work is exactly what I just said, holistically and services. The Urban League works holistically and services subsets to the holistic set of components needed for good health. The list for a healthy life is so much larger than the normal list of what most health definition presents. And healthy life and living defined is in every phrase of what we can do to disrupt a normal life. And that is John's definition. Thank you, John, for that definition. And that's what I'm trying to say and get everyone to realize, is that the work that we do is health is just so much more than that. And we all contribute to the healthy lives of the people in our community. And that's what we need to be able to think through and message to our communities, that this is not just about getting you a house. This is about keeping you healthy and getting you a house. Getting you a house keeps you healthy, right? Getting you employed keeps you healthy. And we're going to talk through some of that in a little bit as we go through this. Okay. I really like this statement because I think it's really important for us to understand. The route to achieving health equity will not be accomplished through treating everyone equally. It will be achieved by treating everyone justly according to their circumstances. And so I'm also going to put another slightly controversial statement up here. It's not that controversial. Equality is not equity. And I know I'm going to say this right now. It is on the bottom left hand of this presentation. The National Urban League sign is the equal sign, right? And that's historically for a reason. This organization started in 1910 when we could forget equity. We were just trying to get to equality, right? It is a historic sign. We are a historic organization. And I'm not telling anybody don't use the sign or that that what we're doing is not the right thing. Everything we're doing is the right thing. But even as a national organization, we are starting to realize that equality is not enough and we have to move to equity. As you all know, we have a new division that started within the past 2 years that is called the Equitable Justice and Strategic Initiative Division. So I want us to realize that just getting, and everybody here knows that, but what we're trying to fight for is not just to get the same pot, it is to get the pot that will make us the most whole. And sometimes that requires more resources coming to communities that haven't gotten it in the past, right? And that's a hard thing for people to swallow. And I know everybody on this call can swallow it, but it's a hard thing to advocate for. But we will never reach equity if we do not think, because equality is not enough. Because equality will never get us to where we need to be to have people be as healthy as possible, because many of our communities are so far behind that just given the same amount of resources, it's not going to help. So I want us to really think through and really embrace that equality is good, but equity is where we're trying to go. And that's hard. So I'm going to say that it's super hard to get to equity because as we go in all those definitions, and we've talked about, a lot of people don't want to let go of resources. A lot of people don't want to let go of power. And in order to get equity, that means people have to release some things, or they feel like they have to release some things. Let me actually say it this way, because actually, there is actually enough to go around if people would not hoard. Right. And that's part of it, is that people feel like, oh, my God, if I release this, I'm going to lose something. Getting to equity does not mean that somebody else has to lose. It means that we're trying to help everybody get to a standard that works best for them and makes them the most healthy. And I think that's the argument that we have to try to get folks to understand and believe, is that getting to equity does not mean that you lose. It means that we actually all win, because we all are living the best life possible. So that is I'm getting off my soapbox for a second, but this is like my statement that sometimes gets me in trouble, but I think it's a really important statement for us to make, particularly in this movement that, for a long time, our symbol, and it will always be our symbol, and it's an important symbol, is about equality. But equity is actually where we're trying to go. Okay, so I love these graphics. I show them all the time. I think they're a really good way to illustrate this point. So equality is everybody gets a box, but we still see that there's a person who cannot see. Equity is the person who is the shortest gets 2 boxes, and the person who didn't need a box to begin with doesn't get a box. Right? That's a tough thing for a lot of people to swallow right now, right? Because everybody wants the box, but you didn't need the box to see. That person could still see. And so what we want, an equitable society, is a society in which everybody gets the resources they need to see the baseball game. Now I'm going to take y'all there. We're not even at equity yet. So we're still trying to get to equity. There are some who argue that even equity is not enough. Where we need to be is at liberation, where there are no barriers to the game. Now, I will tell you, I have used this graphic, and I love me some millennials and Gen Z. I've used this graphic with younger crowds, and I get pushback a lot. I still like it, because they said, well, why are they still outside of the baseball game? Why are they part of the game? And part of the problem is that they're not even part of the game. We can make another graphic, maybe. I haven't found one yet that has the folks as part of the game, but it's a good illustration. And I'm with them. Post-liberation may be, we're not outside of the game, we're part of the game, or we are controlling the game, right? That's a way of looking at it, and I'm fine with that. And I love getting that pushback. So I like to always say it, because I remember, I was enamored with this graphic, and I had some students who at one point really pushed back on me, and I appreciated that pushback, because it's important for us to always continually think about how we think about things, and thinking how we're going to advance the field and advance our thoughts for the best for our people. And so by pushing me on that, I always like to mention it, because I think it's a really good point, that maybe that's not liberation. Maybe liberation, it looks very differently. I see your chat, so I just want to see. I appreciate it, Ms. Janice. So the next slide is another one. And this is actually this is a different slide for people who were at Whitney M. Young. This is actually a different slide. So the Robert Wood Johnson Foundation wanted to find a way, just like the slide before, to depict equality, the difference between equality and equity. And actually their first one is actually this bottom one, the one that they came up, the green one that has, the top is, I give everybody a bike, right? But the person in the wheelchair can't use a able person's bike. The really, really tall person, that bike is too small for them. And the child, that bike is too big for them, right? So the way you get to equality is the way you get to equity, is by giving everybody the bike that works the best for them, right? So they actually got pushback also on this graphic, which I also, once again, used to think was a really good graphic. And not that people didn't think it was good, but people didn't think that it put the nuance into why equity is so important and why it's so hard to get to. And so they actually revised the graphic very recently. I believe these new graphics came out in October to show that everybody also lives in different circumstances and environments, which I think is a really good point. So that first graphic, the bottom graphic, would work if everybody lived somewhere in which it was flat. But what happened if everybody doesn't live somewhere where it's flat? So the example is, the person, you put them in a bike, but they might just need a motorized wheelchair to get around, right? Somebody who lives in a terrain that's bumpy might need a mountain bike. I said a motorbike, a mountain bike instead, because their terrain is different. And so it was trying to account for the environment. If you look at the one with the folks getting off of the sidewalk, you can see that having a ramp actually helps everybody. Also, the older gentleman is hard to see and hard to hear. So you have the light being able to tell people to walk. All those different things help everybody. But we have to take into account people's environment. And that was what the new depiction from the Robert Wood Johnson Foundation was trying to show, is that people also not only need different tools, but they live in different environments. And the tools that work in one environment may not work in another environment. And equity is about giving people not only the tools they need, but the tools that work for the environment that they're living in. And I think that's a really important aspect to really consider context. The wonderful thing about our movement, I talk about this with folks all the time, is that you all are all over the country. You all may have similar problems, but what works in Oklahoma City may not work in San Francisco. What works in New York City may not work in Chicago. What works in Louisiana may not work in Grand Rapids, Michigan. And it's really important for us to understand that there could be tools for solving this problem, but the tools have to be adapted to the environment in which they're going to be in. And that's a wonderful and great thing, which is why I love this movement, because I can work with you all on an issue like COVID-19 vaccinations, and all of you come at it from different angles, but are doing such great work to help your communities. And that is the power that we have in this movement, that we can address the social determinants from different angles, from different ways, depending on the context we are in, but we're all addressing the same issue. So I hope that this helps you to see kind of what I'm trying to get at. Okay, so we're doing really good on time. I've talked to several CEOs and several of you all about, okay, Lydia, this is great. I get it. The social determinants of health, we're there. So now what do I do? What does this mean for me and for the work I do in my affiliate? Do I need to now stand up a whole separate health program? You could, for different things. There are things that are only health specific. My New York is coming out right now. But you all actually do address all of the social determinants. And so I just want to do an exercise that, and I see people are in the chat, and so I want folks to do in the chat, and I'm hoping this works. I don't know if my animation is going to work, but we'll see. So remember earlier in our conversation, I was talking about mortality, and I was talking about why do we think, for example, that Black Americans live almost 10 years less than the group that has the highest life expectancy, right? And so what are the factors that you think, besides medical care, right, that impact why people happen to die early? Just put it in the chat. I want us to just talk about it as a group. So life expectancy or mortality. Let me look at the chat. That would help. So food habits, yep. Racism, love it. Lifestyle, yes. Lack of resources, yes. Culture and access, okay. Access and knowledge about good nutrition, environment, housing location, yes. Okay, so you all got a lot of what I had. So fear is a good one, yes. Homelessness, yes. So there's lots of barriers, right, that cause people to not live a healthy life. And crime, thank you, Calmetta, for crime. So I actually have a list of some stuff that will come up. So there's chronic illnesses, right? People have diabetes, hypertension, heart disease, people smoke, people have cancer. That makes people die earlier, right? Because not all of that is genetic. Some of that is by what a lot of you all put in here, some lifestyle issues. Okay. Next, crime, gun violence, right? We have a lot of people who die early due to gun violence. Okay. So stress, a lot of you put that here, transportation, lack of community togetherness. Okay. Structural racism, I saw people put, this is stuff that I just thought of, and you all came up with all these lists already. I just wanted to put it up there. Do I have one more? So what are the solutions to these problems? Can people list some solutions for me that they think to some of the problems that you all listed and to what I have on this list? Alcoholism. Solutions. Education. Yep. Dialogue. Yes. Allies. Yes. Frequent doctor visits. Yes. Access to care. Meditation. I love it. Healthier food, empowerment and resources, self-love, mental health access is a good one. Ownership of your health, access to healthy food, absolutely. Having community-based partners, absolutely. So let's look at some of the solutions that I listed. I think they all came. So access to care, living wage, supportive living environments, neighborhood environments, political oneness is a good one, right? Urban league programs and implementation. John, why are you taking my answers for? Why John just goes right to my kind of like main point. That's okay. That's why I love John Robinson at Houston. Legislative allies, exactly. So what the solutions column, what does it make you think of? I'm hoping somebody's going to say what we've talked about. What does it make you think of? All of these are what? Liberation, they're equity, yeah. But they're also all social determinants of health. Right? The solutions are social determinants of health, right? Now, looking at these solutions, even though John already gave my kind of answer, what do we know about the solutions on this list? It is the work that all of you already do. You help people find housing. You help people find jobs. You help people, and John says it because he's part of the program. We have a HRSA program that has community navigators helping people get access to COVID-19 vaccine. Why is that important? Why is getting access to something like the vaccine a social determinant of health? Why is that important to our communities? Prevention, yep. It's saving people from going to the hospital and from dying, and dying early, right? That's a huge point of the COVID-19 vaccine, right? Is that we're trying to make sure that people don't go to the hospital and die early. Another thing, when we're getting people housing is not just a place for somebody to live. Housing has so much more impact on somebody's life. It's where somebody can find transportation. If you don't live in a house or you don't live in a neighborhood in which you can easily get to your job, are you going to stay at that job? Are you going to be able to keep that job if you can't get there quickly? The important part of having a job gives you income. A job gives you access to resources. In this country in particular, which is really important, a job also, in most cases, not all cases, gives you access to health insurance. And then access to health insurance gives you what? Access to care. So it's really important for us when we're thinking about the tools that we are using to help people live a healthy life or help people in general. You know, the group here that I'm talking to, we're all about helping people. We're helping our communities, but we're going beyond helping them get housing. We're helping them get access to a resource that's going to keep them healthy. And so what I also want this to be is that when you are talking to the people who come to get your services, when you're talking to legislators, when you're talking to the mayor, when you're talking to funders, it's not just I'm getting somebody a house. It is I'm helping somebody live healthy. And that's the connection that I want us to make with the social determinants and the work we do. The work you do is advancing health equity work. And so now you have another tool in your toolbox when you're trying to advocate for communities and saying, this is not just about getting somebody a job. This is about helping somebody get a job and stay healthy. And that's really important. And that argument, I'm not saying it's hard to beat, but it's a nice tie-in to the work that you're trying to do. So I just wanted us to talk through some of that. So I have a similar example for diabetes. It's similar. The point was to show, sorry, solutions went first. It wasn't supposed to go that way. The point was the barriers are similar. It's medication access, it's diet, it's exercise, it's stress. The solutions are the same. Access to care, your neighborhood physical environment is actually also a lot more important when you're talking about diabetes, because diabetes control in particular is about somebody being able to have access to healthy, fresh food and also being able to exercise. So if you don't live in a neighborhood, if I can't find an affordable housing in a neighborhood that gives me access to fresh fruits and vegetables, and so that I can do physical activity, whether it is going to a gym, being able to have access to a yoga studio or a Pilates studio, or just being able to walk in the park. If I do not have access to those resources, there is no way I'm going to keep my diabetes under control. Plain and simple. And that is what we have to think about. And that's why I say the healthcare system can't always deal with all the issues of health, because the healthcare system can't change where you live. Right? We as a society have to care enough about each other and ourselves and our political will also, this is advocacy, to say that everybody needs a decent place to live. Everybody, and this is, I know we are the National Urban League, but when we're talking about access to care, I know many of you are in counties that are surrounded by rural areas. We have a lot of hospitals and healthcare facilities closing in rural areas, and we're having populations that we care about not being able to have access to the medical care they need to control their diabetes or their hypertension. All that matters. Where you live and what you have access to matters. And the last example I'm gonna go to is just it's actually not infant mortality, it really is maternal mortality. Same thing, access to care, stress, racism. The solutions are things that we do really well. The reason why I like to use the maternal mortality or infant mortality example is I always like to give the example of Serena Williams. Serena Williams is she's a GOAT for a reason, right? One of the greatest athletes of all time. She is a powerful woman. She is a smart woman. She is a very, very rich woman. And she almost died during childbirth. Why? Because they didn't believe her when she says, look, and this is a woman who had a documented blood, like thinning blood, like bleeding disorder. And when she said something is wrong, I don't feel well, I think this issue that I know I have that is documented in my record is going on, they did not believe her, and she almost bled to death during childbirth. So it's not a money issue, right? It's not even a fame issue, because everybody in that room knew who Serena Williams was. And she's married to a billionaire. So besides the fact that she has billions on her own, she's also married to a billionaire. And she almost died during childbirth because people don't always listen to Black women. So racism is a huge part of the issues that we have going on in social determinants, because it also determines if people can get a job, if people can go to school, where people live, can they get access to loans to buy a house, to start a business. All of these things are social determinants that impact how you're able to live, and therefore what access to what resources you have. And going on the whole maternal mortality kind of issue, what we do know is that African-American women have an infant mortality and maternal mortality rate that is less than a white woman who has a high school education. So it's not an education issue, it's not a smartness issue, it's not a financial issue. There is something going on when we are delivering Black babies that is causing either the mother or the child to die. One of the solutions we actually have, and somebody put it here, is community support. And one of those community supports are doulas. Part of the problem is that we don't pay for doulas the way, this is an access to care issue, they're not reimbursable. But these are the kind of things that happen in our communities that we can support, that can support a maternal and infant outcome that is positive and not negative. None of that has to do with what the doulas do, but the rest of it doesn't have to do with the healthcare system. But racism and stress, believing a woman, is all about what's happening in our community. So there is an education component in there also about understanding the stress that women can be under when they're childbearing, and also that racism interacts in many ways, and they have to interact with the medical system so many times. And racism has a powerful force in having them have bad outcomes. And Serena's is just a really famous one. I actually have many friends who, thank goodness, had great maternal outcomes, but who had horrible birthing experiences because people didn't believe them. Right? I had a friend who was refused an epidural because they told her, don't worry, you can take it. So thank goodness she had a good birth outcome, but you can't tell a mother, don't worry, you can take it, you're not going to get an epidural. But this is what happens to women sometimes in the healthcare system. And what other community supports and what a doula can do is help break through some of those issues. So I just want us to know that the work that we do, getting a pregnant woman a stable housing is really important, because she has somewhere to take her newborn baby to. She has access to a refrigerator to make sure that her milk stays cool, particularly if she's somebody who is producing a lot of milk and can store it up. That's important, right? Being able to feed your child is fundamental to particularly in the first few months of life, to what a woman does. And not having a house to be able to store your breast milk, not having a job that allows you to pump, that's a social determinant. If you don't have a job that allows you to pump, then your milk dries up. Your milk dries up, you can't feed your baby. So being able to have a job and a living wage that allows a mother to be able to pump and feed her child is fundamental to her health and the health of her child. And all of those are social determinants. So I think that is actually my last slide when it comes to talking about this. But I wanted to know if there was any questions or comments or thoughts. We have about 10 minutes. I just really want us to understand that the work we do is advancing health equity. It is social determinants of health. And I won't say you don't have to do anything extra and special. I want everybody to be extra and special. But that working in health equity, advancing health equity, is fundamental to the work that you already do. And understanding that link and being able to articulate that link helps you to further help the communities that we're trying to help. So I am going to just stop there for a minute, because the next slide is just the next session, but I wanted thoughts, comments, and I think we have time, since we have about 9 minutes, if folks want to either unmute themselves, raise your hand and unmute yourself, or put it in the chat to make a comment or to say something or ask a question. And also feel free to challenge me. I love to be challenged. I love a wonderful conversation. So don't take everything I say as gospel. I mean, I work hard and I study hard, but I also can be challenged. Okay. Yes, you will get the slides for the presentation. And also, like I said, we're also going to post it on YouTube when I get that figured out. I've almost got it figured out to get it posted on the NUL YouTube page. You're welcome. Oh, there's a hand raised. You can unmute yourself. Go for it.
Yeah, it was interesting that you covered this specific topic because we were just talking about this in our office earlier today. I just had to send a picture of it to someone else. They weren't able to get on the actual meeting because they had to go out to an event, but I sent it to them just to let them know that this is what we were actually discussing. You know, just a picture of the kids at the fence and, you know, and everything there. So it's pretty interesting.
Thank you. I appreciate it. You know, and I think James, I think is your name. Is it James? Yes. You know, it's interesting because when I first decided to start this series out, I was just talking to a bunch of my friends. I have a degree in public health. My orientation is public health. And so I think larger and I think more community-based and less individual-based and more public health. And I was saying, oh, you know, people know this, it's okay. And I had a friend that said, actually, no, people don't know this. And you need to make sure that our communities understand what is going on and how they can be part of the solution. And it really struck me. And that's actually why I wanted to start off with the fundamentals of like, what's going on? It's hard sometimes for us, especially when we're like, you know, this is going back, this is going bad, this is going bad, to understand what the fundamentals are. And I think if we're able to start to piece out, like, what are the fundamentals? What are the things that I can change? What are the things that I actually can do something about? Then we're really able to help and think through, because sometimes we can get overwhelmed. Like, you know, I've done this work for 20 years and sometimes I get overwhelmed by just the level of the disparities. And then, you know, I had a conversation with a friend and I said, you know, but if I can just chip away at it a little by little, then I know I've made a difference. We're not gonna all solve everybody's problem in this one session or in our lifetime, but every small step we make toward equity brings us that much closer to people having health equity. And that's kind of the attitude and the philosophy I take, and what helps me to continue doing this work sometimes when it gets really hard and really difficult and I feel like it's insurmountable. So thank you for saying that, James. Like, it's nice to have us remember that this work touches us all and that we all need to constantly be remembering the work that we're doing and sharing the knowledge with other people. Go ahead, Ms. Sandra.
Lydia, that was an excellent presentation. I enjoyed you also at the conference in New York. But I do want to say that you touched on many things, and I'm not sure how we manage the issue of human empathy and compassion. You know, they don't have courses for that, but you raised a very interesting point about going to your caregiver and they're caring about you as a person. And sometimes this happens and people get second guessed and they don't get the care because they're not listened to. So what do we do about all of the education in the world, all of the programs in the world cannot take the place of human empathy and compassion? So how do we manage that? And how can we as caregivers address this so that we can start caring about what happens to our communities and caring about what happens to one another?
Yeah, no, that's a huge and loaded issue. I will admit, but I think what we can do is, one, it's also a little bit of an issue of civics, right? We have lost this compassion and caring about community and society. You know, this individualism that America has kind of built on, even though we were built on this, thank you, this issue of individualism and I'm gonna, lift them up by their bootstrap. We also were a society that was about community, right? I know we try to act like it's rugged individualism, but there was a sense in the 50s during the civil rights movement of community. And I think we've lost a little bit of that idea of community. I think COVID actually really made us see that, because this was a communicable disease that was airborne. And I feel like there was a certain segment of our population, not our community, of our population that just didn't care. And you know what? I always told people, I said, you know what? You want to go and kill yourself, go ahead. But if you're going to kill me too, I can't be down with that. And COVID was an example where we saw that there's some people that actually just didn't care, right? And so we have to do a better job. And this goes back to what I was saying earlier about what we're doing in schools and how we're teaching our kids about, like you said, community, empathy, whatever religious tradition that you're part of, almost every tradition talks about taking care of your fellow man. And I think we've lost that sense in some point with this capitalistic, individualistic, everybody out for themselves society. That being said, because I'm not trying to end this on a low note, on a sad note, I do think there are many of us who are caring. I mean, I think the urban League movement is a perfect example of people who do care about communities. We go out in the communities, we go out and we do work, we go and hustle for money, we go and see if we can find the resources, we put our resources together to try to see how we can help communities in any way that we can. I have been so overwhelmed and blown away by when there's a crisis that happens in the community, how the Urban League movement comes to support the other community members. And that is what we just have to continue to do and continue to show. In the medical system, what I will tell, this is a side note, what I will tell anybody, if you feel like you have a doctor who is not listening to you, go get a second opinion. You do not have to stay with somebody, a physician. Even if you're on Medicare or Medicaid, there are other Medicare and Medicaid doctors who will take you. If you feel like somebody is not listening, you show your disdain with your feet and you go find another doctor. And that's really important, that you do have the power to find another caregiver, and you should. So that's important to know, because I know medical schools are starting to try to work on this. They have a long way to go. But there are courses. I know the AAMC, which is the American Medical Colleges group, this is actually one of the things they're working on, is people's bedside manner and trust. And, the implicit bias work actually falls in this kind of category, but it's huge. It's changing culture and norms. Somebody had put in the chat, culture and norms. It's how do we change culture and norms in our society? And that's not as easy, but we work at it little by little, and that's what we do. So it's not, I don't think it's not the best answer, but it's the answer I have right now. And some people have put this in the chat. We educate our community on how to find a provider. So it's cultural competency. Some people will now call it cultural humility. So the terms always continue to change, but it is about all the same kind of things. And Tallulah made a good point. It's create a list of interview questions for a prospective doctor. We have to give our communities the tools to be able to get the best resources possible. And some of these are really good tools for finding the right doctor for you who's going to listen. So those are all really great points. Thank you, Ms. Sandra. So we are at time, and I'm about respecting people's time. I hope you all found this useful. I enjoyed the conversation. I just want to say that our next one is going to be, actually, I should have put the date here, February 16th from 1 to 2 p.m. Eastern time. I will be moderating a discussion with a few affiliate CEOs and Dr. Reed Tuxton, who is the co-founder of the Black Coalition Against COVID, to talk about the lessons that we learned from COVID and what its endemic future looks like. So I hope that you all join me next month in talking about what we learned from COVID, because we've learned a lot, and you all have taught us a lot about what's the right thing to do when our government may not have done the right thing all the time. So I hope that you all have a great day. I hope you all have a great week. And I'm hoping to see all of you and more of you next month for our next session. Thank you, everybody. Have a great day.